I am excited to introduce you to today's speaker, Dr. Murad Gormley. Dr. Gormley is an assistant professor at the University of Connecticut School of Nursing. Drawing on her experience as an oncology nurse, Dr. Gormley's research focuses on enhancing the psychosocial health and well-being of individuals impacted by cancer. For more information, you can go to read her full bio on lbbc.org.
The talk today is about fear of cancer recurrence, and it's part of the series of navigating risk of a recurrence after early stage breast cancer. So a little background about myself. I am an assistant professor at the University of Connecticut School of Nursing. And prior to becoming a professor, I worked as an oncology nurse and a pediatric nurse practitioner. I've always been passionate about oncology, but this passion was fundamentally shifted when I was diagnosed with ovarian cancer in my 20s while I was working as a pediatric oncology nurse. This caused a seismic shift in my life. And while the type of ovarian cancer that I had was highly curable, I was left feeling shocked, confused, and like I had been betrayed by my body at what I perceived to be a young and conceivably healthy age. I experienced a lot of fear of cancer recurrence, but didn't realize that these feelings had an actual term until I began pursuing a PhD to study cancer survivorship. I read the literature as they described exactly what I had been feeling. When my oncologist said, "You're done, we'll see you in 3 months," I felt this wave of fear. What would I do over the next 3 months without them? It felt like it was up to me to make sure that my cancer didn't come back. It also felt like I immediately had to jump back into normal life, like nothing had happened. I began to think, if I do this or that, if I eat the right things, avoid this or that, I can make sure that the cancer doesn't come back. And I began to worry when I felt symptoms or sensations, could this be a sign of recurrence? And everything felt like it was a pre-cancer and a post-cancer world to me, like the person I was before would never be back. It also felt like everyone around me kind of fit into these two buckets, those who have cancer and those who don't have cancer. And all I cared about at that moment was being in the category that did not. But with time, things really improved. I began to process the trauma of the diagnosis and started to establish my new normal and how I could reframe my new identity as an oncology nurse. As I said, I pursued a PhD in nursing research and focused my dissertation on fear of cancer recurrence among breast cancer survivors. A lot of my research has looked into how fear of cancer recurrence differs among young women diagnosed with breast cancer and what factors would increase the prevalence. I also examined how genomic tests, such as the Oncotype DX test, may contribute to fear of cancer recurrence. And currently, I'm funded by the NIH to develop a peer-led intervention for Black breast cancer survivors who face tremendous disparities in mortality and psychosocial outcomes. I'm looking forward to continuing this work and honored to be here to talk about fear of cancer recurrence. I hope to convey that over time, this can improve. And while I do not expect to ever be completely free of fear, it has been 10 years, and this experience no longer plays a significant role in shaping my sense of self, which is mostly now shaped by my family, career, and motherhood. So, after presenting a little bit of that background, I just want to dive right into, what is fear of cancer recurrence? So fear of cancer recurrence is a well-recognized concept that describes the fear, worry, or concern about cancer recurring or spreading. And while there are tools or surveys to measure fear of cancer recurrence, there's no universally accepted or gold standard way to measure it, nor is there a well-established cutoff that says this is severe, this is moderate, or this is mild. There are, however, questionnaires that are specific to breast cancer that can help us better understand if you're experiencing mild, moderate, or severe fear of cancer recurrence. And more specifically, we can better understand the nature of the fear. So what the fear is centered on, be it related to fear of death, fear of disruption to your role, maybe as a mother or in your family, fear of disruption to your body image, or the need for more chemotherapy or surgery. And in terms of prevalence, approximately 50% of breast cancer survivors experience moderate to severe fear of cancer recurrence, and the rates are up to 70% among young adults. It can have a significant impact on well-being, contributing to anxiety, depression, distress, and overall poorer quality of life. And there are certain factors that we know influence the degree to which someone has fear of cancer recurrence. For example, age is a very important consideration when we think about who is at greatest risk of experiencing fear of cancer recurrence. Young women in particular may feel isolated and distressed by the diagnosis at a young age, as they may lack more established support networks or be juggling demands of family, work, and children, or they may have concerns specifically about starting a family, advancing their career, or finding a partner. Other factors, such as the stage at which you're diagnosed with cancer, the treatment you receive, and other personal characteristics or experiences can influence the degree of fear of cancer recurrence you have. But fundamentally, it's really an incredibly nuanced concept, and any cancer survivor can experience it at any point along their journey. There is some mixed evidence regarding its improvement with time, but most of the literature does support that it does improve with time since diagnosis. So that brings us to the question, what is a cancer survivor? So the American Cancer Society defines a cancer survivor as someone starting at the time of diagnosis. However, the term survivor can really mean whatever you want it to be. In addition, it's important to discuss when fear of cancer recurrence is most likely to arise, which it typically occurs after the completion of treatment and during the transition to surveillance or maintenance therapy. This is when individuals often feel what we call lost in transition, as they're leaving this structured healthcare system that was dominated by, frequent examinations and very frequent communication with your healthcare team. So this transition period can be abrupt, and it's when individuals typically begin to process their diagnosis and begin the process of establishing a new normal. So during the acute phases of treatment, individuals are often in this flight or fight stage, primarily focused on completing treatment, and then that abrupt transition at the end may provide the time and space to really start processing their experience, and that's when the emergence of these adverse psychosocial symptoms can start to emerge. So that brings us to the question, what really is normal? But fear of cancer recurrence is a normal response to a very challenging and traumatic event. And from an evolutionary perspective, fear can be an important thing because it keeps us alert to danger. However, excess fear can cause significant stress and impact your physical and mental health. As I mentioned, there's not a gold standard measurement that indicates that you have fear of cancer recurrence. We definitely have, tools to measure it, but there's just not a gold standard measurement. But one definition that we have for fear of cancer recurrence that can try to help you identify whether or not you're experiencing, normal fear from, this traumatic event, or if you're having something that might be more of a clinical level of fear of cancer recurrence. So that definition proposes that fear of cancer recurrence is when you have high levels of at least 3 of the following characteristics for at least 3 consecutive months. So that would be preoccupation with cancer recurring and worrying that is persistent, and then hypervigilance or hypersensitivity to symptoms or sensations perceived to be indicative of a recurrence of cancer. So as a cancer survivor, there may be times that you experience an emotional trigger or have a strong emotional reaction to an event, a conversation, or other stimulus. And these triggers can feel very distressing and make you feel like you were on an emotional roller coaster. It's important to acknowledge that triggers are normal, and in many circumstances, they're unavoidable. You can't always predict, what conversations will come up when you're at a dinner party. This happened to me recently. You also can't, or you shouldn't, avoid your routine follow-up appointments. And anxiety triggered by follow-up appointments and scans such as, a CT or an MRI are common, and they've been labeled as scanxiety. And with scanxiety, you may feel as though, you're moving forward and focusing less on cancer, but then as you know an appointment is coming up, or a scan is coming up, a surge of intrusive thoughts, doubts, or anxiety can arise. Other triggers may include things like physical sensations, so feeling pain, or having, a headache, any sort of like physical sensation that might trigger you to think, could this be a recurrence? Certain smells sometimes, it might be something that smells like the hospital, be it hand sanitizer, or then any external events. So things like hearing about someone else's cancer diagnosis, or watching a TV show where a character is diagnosed with cancer. And we'll delve into this more when we're discussing coping strategies. But recognizing emotional triggers is important for developing coping mechanisms. And if there are triggers that you can reasonably avoid, such as skipping a TV show or avoiding cancer survivor blogs, it's important to do so. However, for unavoidable triggers, it may be helpful to plan for additional support during that time. So, for example, if you know you have a scan coming up, that would be an unavoidable trigger in some cases, and then you can build in support during that period. So, how do you know when you may need more support to cope with fear of cancer recurrence? It can be difficult to determine when. You're in need of that more support to cope with fear of cancer recurrence, as compared to when fear may just be a normal response to, what you've been through. So some questions you may ask yourself are, is the fear taking a toll on your physical and mental well-being? For example, is anxiety, stress, or feelings of uncertainty causing fatigue, sleep disturbances, or difficulty concentrating? Have these emotions strained your relationship or made it challenging to engage in daily activities? So, for example, are you frequently seeking reassurance from family or friends? And are they finding it hard to support you effectively? Have you been withdrawing from social interactions or struggling to express your concerns to loved ones? It's also important to note that some people may be more likely to respond in an anxious manner, while others may be more likely to respond with symptoms of depression. And sometimes it can be difficult to answer these questions on your own. So this is a good time to reach out to your oncology team, who might help determine if additional resources are necessary. They might be able to administer survey measures to determine if you're experiencing clinical levels of anxiety, of depression, and then do that fear of cancer recurrence survey. Even though I mentioned it's not a gold standard, we still do have tools that can give us a sense of what you're going through. So now we're going to discuss a little bit about how you can cope with fear of cancer recurrence. But first, I just want to emphasize a disclaimer that I'm not a medical oncologist, nor am I a licensed therapist. A therapist is going to be the person who is best equipped to suggest a specific approach. However, I do want to discuss some of the most common approaches that may help. So first, coping with fear of cancer recurrence is not a one-size-fits-all approach. Effective coping may involve various approaches that are tailored to your needs and symptoms. So everyone is different. And as I mentioned, some people may, experience symptoms that are more on the anxious side, and then others may experience symptoms that are more on the depressive side. So a therapist is really the best person who can tailor your treatment based on how you're feeling. But some examples of approaches include, but are not limited to, cognitive behavioral therapy, or CBT, mindfulness, or for some, their approach may be really focused on finding new meaning and growth from their experience, which often involves creating a new normal or rewriting your personal story that reflects the growth and renewed priorities that have emerged from your experience. So, cognitive behavioral therapy, or CBT, helps to identify and challenge negative thoughts or cognitive distortions. And these occur when our brain kind of twists reality or exaggerates problems, making them seem worse than they really are. So, these distorted ways of thinking can adversely affect our emotions and our behavior. So, for instance, one common distortion is black and white thinking, an all or nothing mindset, where situations are viewed as either entirely good or completely bad, leaving no room, for that nuance or middle ground. But if you work with somebody who specializes in CBT, they can help you adapt to a more nuanced and balanced approach. Catastrophizing is similar to black and white thinking, but in this case, you expect the worst case scenario. So, for example, if you think, I have a headache, it must be a recurrence, you might learn to recognize and label this as catastrophizing. And this pattern often emerges during stress or anxiety. So instead, you might do something where you remind yourself, okay, the most likely scenario is that I simply have a headache. I've experienced headaches, before my breast cancer diagnosis. So it's reasonable to assume that this is another typical headache and not a recurrence. You can then distance yourself from these thoughts and engage in distraction. However, you can always decide, if the headache persists beyond a certain number of days, you will plan to follow up with your primary care provider or your oncologist. But essentially, your goal is to identify the most likely scenario, reframe your thoughts by focusing on realistic and probable outcomes rather than fixating on the worst case scenario. And this approach can help reduce the emotional impact of the distressing thoughts, and then again, promote a more balanced perspective. Another approach is mindfulness, and there is evidence that mindfulness can reduce fear of cancer recurrence and improve numerous other adverse psychosocial outcomes. In mindfulness, you're focusing on being fully present in the moment with acceptance and non-judgment. You engage in activities to try to calm the body, which can include meditation, deep breathing, progressive muscle relaxation, body scans, and yoga, to name a few. And the goal in mindfulness is to regulate the physiologic or sensory processes that will influence our emotions and thoughts. And then when it comes to managing anxiety and seeking reassurance, it is natural to look for support after a traumatic experience, like being diagnosed with cancer. However, it's important to recognize that when reassurance seeking might do more harm than good. And then it might potentially intensify your anxiety and distress. So think of it kind of like adding fuel to a fire. Momentary relief of seeking reassurance may actually perpetuate the cycle. So ask yourself if the reassurance you seek is genuinely helping, or if it's consuming your thoughts and straining your relationships. If the relief you feel is short-lived and leads to a desire for more reassurance, it may be time to shift focus. And then in those cases, practicing distress tolerance can be an effective strategy to help you self-regulate and break this cycle. And as I've mentioned, cancer is a traumatic life event, and it can really disrupt your sense of self, your identity, and your perceived role in the world. It can challenge your perception of your health, stability, and future plans, leading to a significant period of distress. However, it can also serve as a catalyst for personal growth, which has been coined as post-traumatic growth. So some may reevaluate life priorities or discover a deeper meaning in their experiences or a renewed sense of purpose, which can include things like changing a career to align with their passions, or building new relationships, or engaging in advocacy or support for others who are facing similar challenges. Additionally, the experience can help individuals appreciate the present moment and find strength in their resilience. Another way to foster resilience and promote Positive coping is through social support and strength and community. So, spending time with friends, family, or participating in support groups can improve your sense of belonging by being with others who share your experience. This could include support groups that are in person or online. And ideally, these groups are allowing individuals to share how they are coping, offering advice, and providing validation and encouragement. However, it can be important to note that for some, these groups can be an emotional trigger. So, social support does not always have to come from others who have faced similar experiences. Sometimes your social support can come from friends, family, or from your faith. And then on that note, distraction and engagement can be an effective tool to promote coping. It's important to redirect your mind and provide a sense of purpose through distraction and engagement. This can include anything, but some examples included here in the pictures are things like art, hiking, gardening, writing, or music. In terms of navigating survivorship, there are a few things that can help. It's important to schedule regular checkups in accordance with the recommendations from your healthcare provider. You want to avoid a situation in which fear of cancer recurrence is resulting in avoidance behavior and you're avoiding your routine appointments. It's important to communicate openly with your providers about any fears or concerns you've been experiencing. They should listen to these concerns and appropriately follow up with support resources. With that being said, sometimes developing a plan can help you feel a sense of control. Therefore, if you openly communicate with your provider, you can personalize your plan to your specific concerns. It's also important to seek support through whatever means is most appropriate for you, be it support groups, therapy, or time with family and friends. Prioritizing self-care will help promote a balanced life and improve your overall well-being. So getting exercise, eating healthy, and managing your stress, maybe through things like mindfulness, like I mentioned, or distraction. Don't be afraid to advocate for yourself if you do not feel like your concerns are being addressed. If you're comfortable, some people may also want to recognize and celebrate milestones and progress that they've made. And then for many, knowledge can be power. So staying informed on the latest advancements in your care can give you a sense of control. So just some practical tips for some resources. As I've mentioned, mindfulness can be an important tool to promote coping with fear of cancer recurrence. And these three mindfulness and meditation apps are good options for supporting various mindfulness resources, such as guided meditation. They have support for sleep and then other classes for wellness. Calm and Headspace do require a subscription, but Insight Timer has many free resources and access to a global meditation community or mindfulness community. In addition, we discussed the importance of, working with a licensed therapist if that's what you need, if you need additional professional support. And these two resources, BetterHelp and Talkspace, allow you to connect with a licensed therapist in an online format. So that is an option. And then researchers at the University of Calgary developed the mindfulness-based cancer recovery program. It's based in mindfulness-based stress reduction principles, and they offer live and on-demand programs as well as an app with additional resources that are specific to cancer survivorship. And then lastly, some of my take-home messages or things that, I've reflected upon or wish that I had known is that it is normal to experience fear of cancer recurrence after the diagnosis of cancer. However, it's really important to identify when additional support is needed, such as when fear of cancer recurrence is interfering with your quality of life or your ability to complete your activities of daily living. This can all feel like an emotional roller coaster with unpredictable and distressing triggers. These, emotional triggers can be particularly elevated before healthcare provider visits or scans. And so learning to navigate these triggers is going to be a process. You're going to have to identify what works and what does not work for you and what your best coping strategies are. It's important to identify and communicate with someone who is your, support person through these difficult moments and emotional triggers. And then practice self-compassion. You've been through something, very traumatic, but there is an opportunity for post-traumatic growth and positive changes related to your new normal. Thank you.
Great. Thank you so much. Such great information. And I just wanted to say there's really some wonderful support happening in the chat that I've been
Great.
just looking at. Some people were even saying just listening, they were a little triggered.
Yes.
So can you sort of maybe speak to that? It was great that again, they got other support in the chat. But sometimes, to your point, you don't know what your triggers are going to be. It seems like
Yeah.
it's maybe a trial and error type of thing.
Right, right. It's really hard to find that balance between, putting yourself out there in that community where you can get support, like through this chat, but you're also, balancing that with you are going to be you might be triggered. And I think what I would say to that is, engage with these things within reason, and practice those, coping mechanisms, that distress tolerance, some of those, kind of cognitive processes that I was talking about. Just because we're talking about cancer right now, does not mean that you have a cancer recurrence. It's just at the forefront of your brain because we're talking about it. And so I guess I would just really say, you have to engage within these things within reason and know yourself. Know your limits. Know what works for you. Know what's best to avoid. If it's a TV show that you really like, but I've had that happen to me where I'm watching a TV show and I love it, and then all of a sudden one of the characters is diagnosed with cancer, and I'm like, okay, I'm done with that TV show. Can't watch that anymore. Support groups can be very challenging for some people. So I would say proceed with those with caution. It can be very distressing when you're hearing updates about different people within the support group. And then, like I mentioned, sometimes you just don't know when a trigger is going to come up. I was out at a dinner party last week and somebody started talking about something that totally triggered me, and I had to just kind of hold it in during that time. And then I sought out support the next day, kind of got that quick little reassurance from a friend, and that helped. So,
Yeah. And someone put in the chat too about Pinktober being a trigger, which I know,
yes.
especially a lot of our advocates that we work with, we really say like step back when you need to step back.
Yeah.
It can be exhilarating and exhausting.
Yeah.
And I think just to give yourself sort of the kindness and the grace to really step back when you need to do that.
Yeah.
I know that again, I'm 15 years out. And can you talk about maybe, I know for me, what I needed, say, when I was really newly diagnosed, and when you talked a little bit about that time, how it does get better, but I think it almost seems like that's trial and error too, to sort of see like, for instance, I'll just say this. When I was first diagnosed, after I sort of went through, I wanted to help other people. I volunteered on the helpline, and that was really meaningful for me.
Yeah.
Um, and now at this point that I'm further out, that probably wouldn't be, I don't mean that wouldn't be meaningful for me, but doing something different. But can you talk about maybe that survivorship, sort of trajectory of like, how things just change from that
Yeah.
time.
Yeah, yeah. I will say, like I mentioned, a lot of evidence does support that all of this gets better in time. There's that acute phase in survivorship where you're kind of in that fight or flight. You're working on getting through your treatment. You're just focused on that. And then it's like I mentioned, that period when you move into surveillance. That's when a lot of the like processing and the emotions can kind of come flooding in. And that might be a time when maybe maybe you do want to lean into, community. You're just experiencing this, being around other people who have gone through a similar experience as you, might be very helpful, to know that there are other people out there. It was, for me, but then as time, goes on, it might be something that's not as helpful. You're building that, you're adjusting to that new normal. And so then engaging in things like going to support groups or like you said, working with LBBC. It may not be at the forefront of your anxiety. You might start, kind of living your new life. And then that's where things like being exposed to an emotional trigger might be a little bit more alarming because you're in that mode where you're not thinking about it as much, and then all of a sudden a trigger comes and everything comes flooding back and is unexpected.
Yeah. I even know when I started volunteering on the helpline, my sister was really concerned. She was like, "Is that going to be good for you?" And I was like,
Yeah.
"Yeah, it will be good for me."
Yeah.
But even I think sometimes, family members and loved ones that really care about you, they're still trying to protect you, but sometimes only you know what
Yeah.
is going to be best for you and resonate with you.
Exactly. Exactly. Yeah.
Um, so there was a question that came in. Is it normal to feel something like survivor guilt after getting good results on a follow-up appointment? I am happy that the cancer is not back, but a family member, recently passed away and she's feeling guilty and sort of
Oh,
being
so
happy
sorry.
within that. Can you speak to that?
Yeah. Yeah. No, that is incredibly normal and incredibly hard to navigate. I personally experienced that as well, because when I was diagnosed with ovarian cancer, it is a very aggressive type of cancer, and I was diagnosed with something that was more highly curable. And so when I, did engage with support groups and other support mechanisms, it was incredibly hard for me to read all of the stories and see how everybody had a very different experience from me. And I felt a lot of survivor's guilt. I felt like I wasn't sure if I necessarily belonged within that community. But I was open and I was honest about that, and everybody was incredibly supportive, making me feel like there's absolutely nothing to be guilty about. So, I mean, I would say to that person, I'm so sorry, with what you're going through. And then I would say that there's absolutely no reason for you to feel guilty. It's I don't think that that person would, that person is happy for you. And sometimes cancer just sucks. There's no rhyme or reason. And like, to take off my academic hat, like sometimes it just sucks. And it just is so unfair. And that just makes all of this so challenging.
Thank you. I know you touched a little bit about, finding a therapist, I think in your slides, but
Yeah.
someone had asked, should you specifically look to find a cancer experience therapist? And if so, where would you start? Do you have any sort of direction for that?
Yeah, so I think they are going to provide some resources in the chat. But things like cancercare.org is an organization that will connect you with licensed social workers or therapists that have experience in cancer. There are other cancer organizations that I sent out that might be specific. Some of them are specific to, young adult breast cancer survivors. Some of them are specific to Black breast cancer survivors. So there are organizations that do provide therapy specifically for cancer. And then that other resource that I shared with the mindfulness based cancer recovery program does have a lot of sources that are specific to cancer as well.
Great. Okay. Someone has a question. Is there information about how to speak to children about fear of recurrence? I feel like my kids' PTSD has them keeping their feelings in, but I know they worry.
Yeah, so I did a study on young adult breast cancer survivors, and fear of cancer recurrence. And motherhood, as you can imagine, was a very central component to that, in terms of explaining some of the elevated fear of cancer recurrence among young adult breast cancer survivors. And it was divided by children's age. So that is something to consider. You know, the older children were able to understand, what was going on a bit more. And the younger children, they weren't really, of course, able to fully understand what was going on. So I think you do have to tailor it to the children's age. And you have to also know your children, how much honesty they can handle. But I do think honesty is always the best policy, having an open communication with them to the best of your ability, without triggering them, without, just saying that, I was diagnosed with cancer. This is what my doctors say. I have a low risk of recurrence, but it's still, if that's the case, for example, but it's still something that I'm really worried about, and I love you so much. Part of what I'm worried about is that I want to be there for you, and just I think children really do appreciate honesty in these situations without feeling like you're, triggering them or giving them a little bit too much. But of course, it's age appropriate. So answering that question is a little challenging because in this situation, I don't know the specific circumstances or the children's ages, but that would be the best advice that I would have. Or to work with a therapist. You can both go to a therapist and kind of talk through some of the things, and they can support you through that conversation.
Thank you. So someone asked, knowing that there is no right answer, how much time passed for you before recurrence wasn't on your mind daily?
The For me, I would say about 5 years. Um, and then at 10 years, I really got to the point where this is the first time I've ever publicly kind of disclosed my diagnosis on a recorded session. And what's interesting for me that I've seen now is in becoming a mother, I've been making friends, with my children's friends' parents. And in that process, there are so many of them that I've known for 4 or 5 years. And, all of a sudden a conversation will come up and I'll be like, did I ever tell you that I had ovarian cancer 10 years ago? And that's been something that's really interesting for me because it used to be when I was closer to the diagnosis, I couldn't really get very far in a conversation without it coming up. And so with time, like I kind of said in the beginning, it's become less a part of who I really am. It's changed me forever, but it's become less a part of my story that I present in a daily basis. So I do think, and the literature does support 5 years, with fear of cancer recurrence improving after 5 years. But like I said, these emotional triggers, they can show up at any time, completely unexpected. So it may not necessarily be something that goes away completely, but I think you begin to have a little bit more faith and you learn to process those distressing moments a little bit better. So, for example, it used to be if I felt anything like a lump or this or that, I always, thought, oh my gosh, what if it's a recurrence? Now my brain is better able to process, okay, we've seen this a million times. This has happened a bunch of times. It's this or that. It will probably be gone in 2 days. And then it is. If it's not gone in 2 days, then I will talk to somebody. So I think that that really helps.
Yeah, I so like what you said too, to sort of put boundaries around it. Like, okay, I'm experiencing this, and if it's not gone in this amount of time, I'm going to
Yeah,
take this action.
right.
Um, I know for me, I want to say, it's interesting that that 5 year mark, but I think that is a lot of times. Sometimes you get that from the oncologist too, to
Yeah,
say, around 5 years seems to be some data too. I think for me as well, if it wasn't in my head daily, probably 5 years. Now, again, I'm also working in
yeah,
breast cancer with,
yeah.
with advocates, but I think it as time goes by, it does start to dissipate. However, there have been times where I have been triggered where I didn't even see it coming. I had
Mm-hmm.
no, like, I really was sort of blindsided. And then I had like this internal discussion to say, really? You didn't see that coming? Why didn't you see that
Mm,
coming? You know, um, and then there's because it was things like I can sort of see coming when I go for my annual MRI.
right.
That sort of happens. There's things that are like known quantities, um, where you anticipate it, and then there's others where you're like, wow, what just happened there? Um, and I think then you learn. You go like, okay, now I have that information. I've got more information about it. I understand now that that's a trigger. I didn't know it was a trigger before.
Yeah. 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 And like I said, it's important to think about the triggers that you can reasonably avoid and then, have a plan for the triggers that you can't avoid. And so finding that balance is important, but it's a process. It's going to take a while to learn, what is it might be a little bit of trial and error as you go to a support group. Is this a trigger or is this helping me? What boundaries do I have to set around that? How deep into the blogs, should I get? Things like that. So, and then I think it will take time to figure out, what works best for you when you are triggered. And I did talk a bit about, finding that balance with reassurance seeking. You don't want to get to the point where you're asking somebody, 30 times a day, like, oh, do you think it's this or do you think it's that? But it is okay to seek reassurance, especially in the beginning. Like it's very appropriate and very normal to really struggle with this in the beginning. And people are there to support you. They should be there to support you. Your healthcare provider team should be there to support you and really guide you through this. Because, like I said, you can feel very lost in transition after your treatment is done. It's very scary to leave and have somebody say, okay, see you in 6 months, see you in a year. And you're like, what? Well, what am I supposed to do in that year? I'm used to seeing you every 2 weeks. I'm used to having you do a physical exam. I'm used to getting scans constantly. And so taking that leap of faith to enter into that new world, into that new transition is very challenging. But don't be afraid to lean into your healthcare providers. They should be there to support you and help you navigate through these fears and through, what is a normal symptom to feel, what isn't, and when, additional resources are needed.
And really to be your own best advocate,
Yeah.
and that if you and push, it's okay,
Yeah.
to again go back to your healthcare provider. And I think sometimes we feel, maybe I'll speak for myself, I don't want to be a bother. I
Yes.
don't want to
Yeah.
bother them. Um, but that is what they're there for
Yeah.
you to get that reassurance. And there's so many wonderful, there are, whether it's virtual groups or Facebook groups. But I think a lot of times, we have our closed Facebook groups, and I think for some people it's super helpful to get all that information, and for other people, it's not. It's fear
Yeah.
inducing.
Yep.
I
Yep.
think even uh, on our helpline that we have, when we train our helpline volunteers, yes, they're there to be matched with someone similar, but it's also to say, this is my experience and everyone's different because everyone is different,
Oh, absolutely.
in that.
Yeah.
Um, Let me ask, someone had a question. Can you talk a little bit more about distress tolerance?
Yeah, so that is definitely something that, therapists are able to work you through. But that's the idea of, kind of labeling the thought. So, kind of if I went back through this example of I have a headache, could it be a recurrence? And sitting with that, labeling it, saying this could be a cognitive distortion. I'm, telling that story of like, okay, I'm going into that black and white thinking again, you know, and just sitting with it, breathing, going into your coping mechanism, be it, do you need meditation at that point? Is it a distraction? Is it, a physiologic stimulation? Like sometimes people say, smelling something, smelling, touch, cold exposure, whatever works for you to help you sit through those feelings, label those feelings. Thoughts are not facts. So just because you're thinking, could I have a recurrence because of that, does not mean it's true. And then just working through that. The more that you can train yourself to sit through those, distressing thoughts, label them, and then distance yourself from them, the better able you'll be able to tolerate. It's that whole idea of like, before we used to say, let's just push down our emotions, like don't, just hide them, stuff them away. And now, it's better for us to kind of sit through them, work through them, label them, and then try to distance ourselves from them. But specifically, a therapist is going to be much better equipped to walk you through
Right.
those specific steps.
So there's a question that, again, earlier in your presentation, you mentioned genomic testing and possibly causing more anxiety. Can you please explain a little bit more about that?
Yeah, so I actually have a slide about that in case anybody asks, but I just have it in my notes. But essentially, my doctoral research was all about oncotype DX testing and fear of cancer recurrence. And what we did find is that women that had a higher risk of recurrence as determined by the oncotype DX test. So for those, let me go back in case some folks don't know what the Oncotype DX test is, but essentially it looks at specific genomic markers of your breast cancer tumor. So it's not, a marker like a BRCA gene. It's looking at the genomics of the breast tumor specifically. And based on those markers, it can tell you whether or not you have a low, intermediate, or a high risk of recurrence. And based on that, they make treatment recommendations. So you can avoid chemotherapy, or you should have chemotherapy, or you're kind of in that middle and we're not sure what to do. So I was really interested in whether or not, being told that you have a higher risk of recurrence would increase risk of recurrence. And what we found is that people did have a higher fear of cancer recurrence if they had a high risk of, genomic testing results. So they were correlated, but that doesn't, and they were significantly correlated, but that does not mean that every person with a high risk had low fear and every person with a low risk had, low fear. So for example, we found that they were associated, but it was really the best predictors of fear of cancer recurrence were their level of anxiety and their illness representation. So that was like their perceived consequences of, having an recurrence and kind of their emotional response to their diagnosis of breast cancer. So essentially, what we can say from that is like, yes, being told that you have a high risk of recurrence from a genomic test may mean that you have higher fear of cancer recurrence, but we did qualitative interviews as well. So interviews with some of the participants. And it's really incredibly nuanced. There are people that have an incredibly low risk of recurrence from genomic testing, but they are experiencing severely high fear of cancer recurrence. And then there are people that have a really high risk of recurrence, but they feel like, wow, this genomic test told me I have a high risk. So I got chemotherapy because of that. And so I know I made the right decision. And some people just are better able, to cope with this. I think for some of the people that maybe have that really high fear of cancer recurrence, but low risk, it could be things like, a lot of them were young mothers and they just felt so much pressure to prevent a recurrence. So, yeah, that was not a perfect answer in terms of, again, the answer for all of these things are everything's very individualized, everything's very nuanced.
Yeah, it's almost like you just need it's almost like you need a lot of tools in your toolbox and you test out those tools of
Yeah,
what works for you. And that's
yeah,
going to be it, like you said in one of the slides, it's not a one size fits all.
yeah.
So there was a question, how do you approach relationship changes that arise out of cancer treatment? I've ended some friendships, I've gone no contact with some family, realizing some people were very unsupportive. I also have a friend that I want to keep who is a natural born catastrophizer that I've had to
Mm.
limit my contact with. I just feel I've got to be ruthless about minimizing stressors in my life. Any advice?
Yeah, that's really hard, and I'm sorry that you're experiencing that. I do think that I suspect you're not alone in feeling that way. I think that, like I talked about, sometimes this can be this kind of like transformative experience. It makes you question your existing relationships. It gives you an entirely new perspective on life, on who you are, changes your priorities. And so I would suspect that you're very much not alone in that, in feeling like, okay, maybe some people's true colors have come out, or, maybe some people just aren't equipped to support me and meet me where I need them to be. And so they're not the right person for me to focus my attention and my time on at this moment. Otherwise, it's very normal and does happen, where you have a friend who maybe is triggering you, or is just not, it's not a productive conversation or relationship. And what you could do is, one of two things. You could talk to the person and say, listen, I've been through this. I do feel really triggered when you talk about X, Y, or Z, or when you say X, Y, and Z to me. You're giving them an opportunity to kind of fix and repair some of the ways in which they're communicating that might be triggering to you. Otherwise, you can just slowly distance yourself from that person, and there might be kind of a natural resolution to that friendship. But I do think, so for some people, you're given this kind of new perspective in life, and it is more than appropriate to reprioritize the people who are supportive to you, are important to you, and who are worth investing your precious time in.
Yeah. It's so hard. I mean, when I was in active treatment, I had a dear friend, and she wasn't supportive, and she didn't know how to be supportive. And she was one of my closest friends. And I just had an honest heart to heart, and I was like,
Yeah,
I got to talk to you. I was
yeah,
like, here you go. Here's what it is. And this is a really hard conversation for me because I am not like that's a confrontation to me.
yeah,
But I couldn't not say anything. I had to say anything. And at that point I didn't really know what our friendship would be or would not be.
yeah,
And we did get through it and we changed, but I really said, this is what I need from you.
yeah,
Um, and it like I said, it could have gone either way.
yeah.
Um, So there's another question. Do you have any advice for women who feel like they can't move forward because of fear of recurrence? For example, I'm a young mother and I was planning on having another baby before being diagnosed. My doctor told me to get excited about the end of treatment and that recurrence risk is low. But they don't recommend getting pregnant again for several years because the highest chance of recurrence happens within the first few years. But I think more like how do you move forward within that?
Move forward with the, not
Just,
necessarily with the
I think
pregnancy,
more
but
like just the fear, the real fear of recurrence.
yeah,
And I
yeah.
know she's specifically talking about her individual experience, but I think this is more sort of a general question. But really like, what's the first step you take if you feel like I am just living in this fear of recurrence?
Yeah, yeah, absolutely therapy. Working with a therapist who is going to identify, the best approach for you, be it cognitive behavioral therapy, and there's other approaches that you can do that the therapist will determine. You could also just start, in the interim, try starting with some mindfulness, speaking to, leaning into support from others, speaking to your oncologist, just getting that reassurance from your oncologist is totally appropriate. Developing a plan with them so that you feel like, okay, I'm communicating to you that I'm experiencing a lot of fear of cancer recurrence. Talk to me about my specific diagnosis, my specific risks. What does this look like? How often am I going to be coming in? When should I call you? What's normal? What's abnormal? Sometimes those knowledge, knowledge can be power in those situations where I think this person may feel very lost in transition too, where you're going from, that kind of structured healthcare system to this unstructured. So I would recommend, going back to your oncology team, really expressing that this is something that's going on, and you may feel a sense of relief if you know you have a plan with your oncologist. So, for example, for me, I had blood tests done every 3 months, and then I had, a CT scan at 6 months, and then every 6 months I saw the oncologist. And then we changed, you slowly change and move those things out. But I had a, conversation with my oncologist because I really wanted to be a parent, and I felt like, okay, if this recurs, I'm not going to be able to do that. And so I was very focused on trying to prevent a recurrence. But I felt like in conversation with my oncologist, he could say to me, I got you. Like, we got this plan. If we see this LDH marker going up, we know that, we'll do this or we'll do that. Like, I've created a plan for you where I'm going to keep track of this, and I got you. So that's one approach, going back to your oncology team, leaning into your support community, distraction, getting out, getting active, leaning into your hobbies, all of these things. As much as you can distract yourself, the better. And then working through, those moments when you do feel really distressed. What is it that's bringing you down? Is it mindfulness that's bringing you down? Is it a walk that's helping to bring you down? Is it calling a friend? Is it getting out in the sun? What are some of the things that can kind of like calm you down from those elevations of fear? And then absolutely working with a therapist who's going to kind of get to know how your brain is functioning, and then get to know what the best approach for you is. Is it cognitive behavioral therapy and working through with you those scenarios, kind of like the headache one that I laid out?
Yeah, thank you. I mean, I like that sort of like laying out the plan so that you
Yeah.
have more information and you know what's coming. Someone used a term in here, and I think that would mitigate emotional whiplash. There was a
Mm,
question sort of around that. But I feel like then having those steps, you have sort of less of that shock of, oh, see you in 6 months when you don't even
yeah,
know what's in between month one and month six, before
yeah,
you come back.
right.
One other question I want to ask this, and if we don't have information on it, it's okay, but how about management of chronic stress as a preventative to recurrence? Is there a correlation?
So this was actually what I wanted to study my dissertation on. I really wanted to look at fear of cancer recurrence and markers of chronic stress. So things like cortisol, and whether some of those things could increase the risk of recurrence. And I assume that's what you're asking.
Yes. Yep.
Yeah. So we know and we don't know, it's kind of one of those things like we know that stress causes, um, it wreaks havoc on our body. So we do know that. Do we know for certain that it increases the risk of recurrence? No. Definitely not. We can't say that definitively yet, but does it help to, mitigate stress in that kind of survivorship period where you're done with treatment? Yes, absolutely. But it's one of those catch 22s where it's like, you're telling me to not stress because stress could be, harming my body, but then now I'm stressing about it harming my body. So I try to be careful with how I talk about that because I was somebody who was, very stressed in the survivorship period, and I know I kept telling myself like don't stress so much, this is not going to be good for you if you're stressing. But I still think it is good to have that knowledge because it could be the thing that really pushes you to try to take care of yourself, prioritize your self-care. Like if there's any reason, to really take care of yourself, be it, for your family, for your friends, for your loved one. Also, try to take care of yourself because, you want to be good to your body. Um, yeah, of
Thank you.
course.
That was the last question that we had,
Okay.
but I just wanted to sort of see, is there any um, last final comments that you want to make before we sort of close out our program for the evening?
No, I mean, I wish I could have seen this chat, because I know there's a lot of activity in it. So I want to thank everybody for coming. It was really nice to be able to do this, and I'm sending lots of love to everybody. I really hope everybody's doing okay. I know that this can be a hard thing to talk about, but you did a hard thing, and you did it, and you're here. So take care of yourself tonight, get some extra rest, lean into things that make you feel good. So thank you so much.
Thank you.